Namaskar. Welcome to Ahara Arogya Adhyatma, the light of Samskara. Today we have Dr. Raxith Sringeri R. He is a senior consultant surgical oncologist, robotic center cancer surgeon. More than that, he is working in a Clear Medi Radiant Cancer Center in Mysuru. He is an expert in minimally invasive oncology and oncoplastic breast surgery. And he is a double gold medalist, both in MS General Surgery as well as in MCH Oncosurgery. And he has received Advanced Da Vinci Robotic Surgery certification also. Though he is expert in surgery, today he has come to tell us how to prevent and how to treat the colon surgery. Welcome, Dr. Raxith.
Thank you
Nowadays,
so much.
yeah. Nowadays, we see lots of people coming with the colon surgery, colon surgery. In the past, we were not hearing so much. Now, more younger people are coming. What is the cause for it?
I think we are all worried about balanced life, but we have forgotten how to do a balanced diet. So, if
Okay.
you ask me, the most important cause for colon cancer is the diet.
Mm,
And we in the era of faster generation and faster food. So, the
mm.
incidence of colon cancer from the older age, it has coming towards the younger age group. Because
Okay.
from 10 years of my practice, it's not so alarming, but still it is slowly it is increasing in
Mhm,
incidence, and
mhm.
more alarmingly it is coming with the younger age people. Why?
Okay.
Antantana? Mainly because of the diet,
Okay.
sedentary lifestyle, and most
And
importantly is this
obesity.
yes, obesity. And
Mm.
most importantly, what I'm seeing is this processed foods, this coloring agents, and the even refrigerated foods. Prolonged
Mm.
refrigeration is also not considered as a good for your feeding. Why the
Oh,
older people have better health? Because they used to cook the food, eat it,
mm.
and they used to end it. They don't used to
The
refrigerate it.
fresh fruit.
Yeah.
No, they never used to eat the
Yes.
old one. Yeah.
And our
Mm.
see the South Indian meals. Why I'm always stressed about my patients. South Indian meals. We have a very good meal.
Mm.
Morning you eat like a rich man. Afternoon
Mm.
you eat like a common man. Night you behave like a beggar. That is what it is there. The most
Okay.
importantly, my North Indian friends or whatever is there, we used to have that curds at the end. Without
Yes.
completion of curds, we
Yeah.
consider it as an
Curds is a
incomplete meal.
probiotic and it is so
Yes.
good. It prevents the
So this is
cholesterol absorption also. Yes.
See, this was the balanced diet which we used to follow. Morning
Yes.
breakfast, idli and sambar. Simple
Mm.
idli and sambar concept. That is an antioxidant.
Mm.
Night time we used to have these fiber foods, more of
Mm.
vegetables, ragi
Mm.
muddes, all
Mm.
those lot of vegetables. See, still remember my father used to cut vegetables, sautekai, that is called cucumber and carrot
Mm.
at night, because these are the
Mm.
fiber diets. This is what is
Okay.
required. And still remember my grandmother used to shout at me, finish your dinner by 7. Don't
Yes.
eat just before you're sleeping. That is not good.
Yes.
She used to tell this is a bad omen, but actually that is a
Okay.
bad, that is required. That
Correct.
is what our body is destined. We should not eat just before the
Mm.
sleep. By
Okay.
7, we should complete our diet, and diet should be balanced. It is more of a
Mm.
fiber diet, antioxidants, and less of
Mm.
processed, less
Mm.
of fast food.
Mm. Okay. So our ancestors, our grandmothers and parents, they knew better eating, more scientific eating than what the younger generation is doing. That's what you are telling. Now,
Yes.
suppose they are into bad habit of eating wrong food and just ordering and calling the phone and then getting the food which contains all bad oils repeatedly and then used, and also the preservative and coloring agent, taste enhancer, all are carcinogenic. And now, how will the patient know that he has got a cancer? How will they come to you? And what are the symptoms and the signs they have to come?
What you have said was right about our ancestors.
Mm.
But the symptoms what ancestor used to face, the symptoms our younger generation, the
Mm.
most important for any colorectal cancer, they come with a
Mm.
bleeding
Mm.
per rectum, and
Mm.
majority of them are googled or chat GPT, whatever it is, they think it is a
Mm.
piles or a
Mm.
simple piles. Sometimes they treat themselves with some local treatment, or they are so much embarrassed they don't want to show to the doctor. Maybe fear it may be diagnosed as a cancer. They go to the some local nati or a alternate medicine they used to take, and they used to come at a later stage. Even we urban population, yes, in rural population still existed. Bleeding per rectum, that is most ignored part of symptom. Second most in urban population, what I've come across is the rapid weight loss. They say they go to gym, they have doing the good diet, they're losing the weight comfortably. Is this is okay? Sometimes when we when we do a proper screening of them, we have diagnosed a colon cancer. So one is a bleeding, second is an unexplained weight loss. You don't,
Weight loss.
you cannot lose the weight.
And
Drastic
that
weight
too,
loss is not.
rapidly,
Yes,
drastically
rapid
losing the
weight loss is
weight.
not
Yes,
advisable.
yes.
Second most, the third most I can come across is the altered bowel habits. Sometimes she will have a blotting sensation, constipation. Sometimes they have a diarrhea or loose motions. Some kind of blotting or a dyspepsia kind of symptoms will be there. Second, sometimes there are abdominal distension. These are the common signs and symptoms of early stage. We can predict it at the colon cancer.
Okay. Okay. Now that they have come to you, what are the investigations that you do to diagnose and to specifically decide that this is colon cancer?
So whenever the patients, I ask them why you came late, because sir, you will always advise colonoscopy. We are scared of colonoscopies because
Okay.
something is going inside my rectum. I'm not so comfortable. So that fear is still there. But
So
now,
these are the Google Guru patients,
yes,
they would have
yes,
already Googled and come.
already Googled and
So,
they come. Sir,
but
I don't want to.
now it is a fiber optic and it is so small, so they don't have to
So,
fear. Yes.
yeah, now we see the older things have gone. We have in the era of virtual colonoscopies, the colonoscopy procedures are painless. We have to do colonoscopy, we have to take a biopsy. Biopsy determines what type of cancer we are in, and this actually determines the treatment. After that, we can get either CT scan or a PET CT scan to stage the disease. So, colonoscopy is the must, and it is not the most dreadful or a fearful procedure. Colonoscopy nowadays is a simple, painless, it's a day-to-day procedure. It,
Very
you
easy.
don't have to be you don't have to be feared. Even if you have a bleeding, you don't think if you're bleeding, some signs are there. Even if there is colonoscopy is negative, there is no need to regret. Even some patients comes and tell me, sir, you have not found anything unnecessarily. I went colonoscopy. Why did you do colonoscopy?
No, but
To
it
suggest,
is a blessing,
yeah,
for them that
yeah, it
they
is
can be
not there.
very
So it
happy
is.
that it is not there. Cancer is not there.
So, but our people mentality is that, sir, unnecessarily I went colonoscopy. There is nothing.
No.
Then I will always suggest them, since you are already in the colonoscopic screening, 1 year, after 1 year, you have to come back and do colonoscopy again. Sir, what is this? This is the normal screening protocol for your symptoms. We have to do it.
Okay. Now that you have done the colonoscopy, you have taken the biopsy, and the biopsy report comes, and then according to the stages, how do you manage the treatment? What is the treatment?
See, the colon, any colorectal cancers, we have, see, the colon is the upper part of the intestine, and then is the larger intestine. The lower part of the colon or a distal part, we
Is
call
the
it as a rectum.
colorectal.
So rectal cancers we usually manage with radiation chemo followed by surgery. And colon cancer usually 80% of the chances is managed with surgery. So when I started my cancer surgeon journey, it was a bigger procedure. We have to
Yeah, I
open the
know.
abdomen,
The whole
larger
abdomen
intestine,
they used to cut
abdomen
and
was
then you do
open.
it.
We have
Yeah.
to take out the larger intestines. And more specifically, I want to stress out here, just not removing the colon will give you the benefit. The best benefit is colon with the circumferential radial margins and the lymph node dissection. So good surgery means there is adequate margins clearance from the colon cancer with lymph node dissection gives better survivability. So why surgical oncologists should do cancer surgeries, colon surgeries? Because we have thought to do a radicality. So open surgery was considered radicality. Now the best example I give you, 2 days back I have done a robotic right hemicolectomy. Patient was eating next day, discharged by evening. He's going back home. There are no drains, nothing was there. In previously, the open surgeries, patient has to wait for a longer days, 5 to 6 days, no food to be given until he passes the flatus. Now we in the era of robotic surgeries, advanced laparoscopic surgeries, with older days, we used to do a hand-sewn anastomosis. We have very advanced stapling devices. The surgery will finish in very fast manner, precise, with a good vascular control as well as lymph node clearance. So
and less
don't get,
complications.
yes,
And
the less
hardly any
because
complications. Yes.
because we are seeing the smallest of smaller vessels are seen by robotic eyes, so that the complication rates are very less. So the most common complication we used to have these adhesions. So since we are not opening the abdomen, we are doing a very keyhole surgeries, so the complication is less. You don't have to be bedridden for a longer time. You can eat balanced diet again, not erratic diet again. You have cleared, but you have to be balanced again in your life. So don't get scared. Colon cancer, it's a minimal access surgery. We are in the era of robotic and minimal access surgeries. So colon cancer, it's not a painful surgeries. It is nowadays, it is very less painless, and it has a good recovery phase.
Okay. So when you said hemicolonectomy means half of the colon is cut, half of the large intestine is cut, and still they recover very fast. That's what you're telling. Now,
Yes, sir.
after the surgery, do they have to take chemotherapy or radiotherapy, or just surgery is enough?
So everybody's question is that, see, the once comes the cancer, when anybody's they hear the cancer, the most feared treatment they hear is the chemotherapy.
Treatment, yeah,
Yes, the
chemotherapy,
chemotherapy
losing
is
the
the,
hair, and then,
yeah,
it's
that is
sickening.
lot of classes. So now we are in the era of de-escalations. So what we have to do is something called a liquid biopsies. Patient is an early stage colon cancer, underwent surgery. Now, whether this patient requires chemotherapy or not. Previously, we used to treat the patient based on the morphology, histology, and the staging. Now, we want even more further. We are in the liquid or a genetic biopsy. We do a liquid biopsy. We look for the circulating tumor DNA. If it is negative, that means this patient is completely cured. Surgery is enough. He can put on follow-up. If it is there, then we'll go for further genetic testings. There are PDL1, there are MSI testings, and what best can be done for the patient. Initially, you remember, when I was in PG days, the 12, 14 cycles of chemotherapy was given. Now we are now, because based on genetic morphology, we're getting very de-escalation, 4 cycles, 6 cycles, 8 cycles. Even furthermore, we have very advanced immunotherapies. They don't have any side effect of chemotherapies. So they come, they go back home and start working. So we have advanced immunotherapies, targeted therapies, and even the chemotherapies are de-escalated based on genetic morphology.
Okay. Yeah, what you have told, it looks wonderful that it is a blessing that the advanced technologies have come for the benefit of the patients. But what the patients have to remember is go back to the olden days of eating. Eat the old methods of eating and use the new method of treatment. And then thereby you can bring down the incidence. Because among the top 5 cancers, the colon cancer is also one of them. So it is because of the wrong habit, as you already told, not to eat the red meat, not to eat the junk food, not to eat the, the instantaneous food where the more preservatives and chemicals and salt and other things are used. And then don't fear, come to the doctor in time and get rid of the unwanted cancer cells. So thank you very much, Dr. Raxith. You have given such a very clear, candid picture of colon cancer, and I'm sure all our viewers, they have understood. And then if they have any doubts, they can ask questions and then you can answer to them. Thank you very much.
Thank you, ma'am. Thank you so much, ma'am.